Good morning, and welcome to Caretaker's Corner, where we discuss everything that has to do with taking care of our elderly disabled parents, our disabled spouses, and our adult disabled children. My name is CJ, and I'm here to help you on this journey, I hope. Today we're going to discuss nonverbal communication. I started this small series on proper communication a couple weeks ago, and last week we did one on empathy. And this week it's going to be on nonverbal communication, different forms of it, and how we can relate to it. So I hope this helps you out. I will be referring to my notes, so if I look off to the side, that's what I'm doing. And it doesn't help that I'm not very good with all the ins and outs of lighting and stuff, so I can't wear my glasses because of the reflection. So if it looks like I'm squinting or moving into it, that's because I am. I'm actually quite blind, and but I don't like the how everything, and it doesn't matter how I do the lighting. I haven't found anything that will not reflect off my glasses. So we're having some fun with the cameras. I'm trying some new things and learning some stuff. You're gonna hopefully notice it when I actually post this. There'll be some cool stuff going on with it. We had a lot of snow, and so I had some snow days from work, and I tried very hard to use that time efficiently in learning how to do better videos. So here's to this. But we're going to discuss nonverbal communication. Now, like I said, last week we discussed empathy and how we have to be, as caretakers, we have to be very empathetic. Now, all of these things I'm going over stack on top of each other, and we use them together. They're not separate. To be massively good at communicating anywhere, you need to be able to put all of them together, but specifically with caretaking. Because as I've mentioned previously, some of our individuals, the people that we take care of, they may not be able to communicate back. They may have issues like they've had a stroke or dementia, and they may not understand all these cues that they grew up knowing, and they don't know them anymore. And so that falls on us as the caretaker to put that extra work in to try and help with the communication. And I know I'm not the greatest at it, and I have failed considerably at times, but we have to remember that they're grieving, they're agitated, they're upset over their situation, and we have to try our best to understand what they're going through, to show them that we understand what they're going through, and to help them accept the situation and continue to live a good quality life given whatever their situation is. Whether it's dementia, whether it's a stroke, whether it's like in the case of my brother where he lost the use of his legs for a while, or like in the case of Barbara where she has lost a lot of abilities because of her condition, and I mean for about 5 years been basically bedridden. So these are things we got to help them be able to work through and to be able to communicate how they're feeling with us. And like I said, it falls on us to be able to help with that. So this week we're going to discuss nonverbal communication. And nonverbal communication is things like gestures and just listening and your eye contact, facial features, different things that go on with the body that would symbol some sort of a communication or a change in our loved ones. Then there's also some more obvious ones like using communication techniques like props, whiteboards, and stuff like that. So we're going to start out with the power of presence, which is just simply being present. Now, you're like, oh, well, duh, I'm there all the time. No. You can be there, and they can be talking to you, and you can not be there. So when you're there talking and you're having a serious discussion, right, put your phone down. I know that sounds stupid and it sounds silly, but we live in our phones. And we can, like, for instance, I was at my mom and stepdad's on Friday, and there came a point where my mom was paying way more attention to her mail than she was the fact that we were trying to have a conversation. So, I mean, just something as simple as, doing anything besides that conversation. When you're there, be in the moment, be listening, be present. Don't be on your phone. Don't be reading your mail. Don't be trying to clean. I mean, I know we have to multitask as caretakers, but there does come a point where we have to stop what we're doing, pay attention to those people that we are taking care of, because they're trying to tell us something, and we need to know what that is. And they may not be able to communicate it properly, so the more we pay attention to them, the more we're there in that moment, the better off we can make sure that we understand what they're trying to communicate. Another technique is mirroring and matching their movements, their mood, and what they are doing. Now, we don't want to be mocking, all right? You don't want to make it sound like you're making fun of them when you're doing this. But if they're somber, be somber. If they're agitated, you don't want to be agitated, obviously, but you want to be able to mirror the mood that they are setting. Sometimes you have to repeat things that they say, or you have to repeat movements that they're doing in order to help with the communication process. So you want to keep that going. Authenticity and congruence. And this is really difficult with nonverbal, but it is the most effective, especially with being authentic. You don't want to, like I said, you don't want to be mocking. You don't want to try in any way of making fun or doing something that might upset them. But your body language, your facial features, your tone of voice, which mine's apparently trying to go on me, you want those to align with your verbal message that you're giving, okay? I tend to be a happy person or a very positive, upbeat person. And if I'm not, everybody knows it. And it's one of those things that I'm always, or I hope I'm always, a very positive and upbeat person. And people tend to know when I'm not in that mood, because everything is congruent, right? My facial features, my actions, and my voice will all be congruent with how I am feeling at that moment, or with what I'm trying to convey at that moment, whether it be seriousness, whether it be a joke, whether it be relaxing. I'm trying to convey completely through with body language, with my voice, tone of voice, with the message I'm giving. I want everything to be congruent and authentic. They can pick up on this, whether we're talking about people we're taking care of or people that we pass or we work with or whatever. They can pick up on this, especially if they're around you enough. And the more authentic you are, the more congruent, the better it is for communication. Kind of a final thought on that is your presence, your genuine care, and your consistent, positive, nonverbal communications can make a world of difference to those people you're taking care of. Remember, you're their everything. Well, like I know for a fact with Barbara, I work, I got a YouTube channel, which I love, and I've got chores. I try and go to the gym. Because of weather and work, I haven't been that consistent with it. But I've got all this stuff that I do outside of my caretaking responsibilities. But for her, 99% of her day, I'm the one that takes care of that. I'm the one that provides for that. So while I have other stuff going on, most everything about her is about me. Me being there to help her out. Me providing for her. Me fixing her meals and walking the dog for her. And it's all about, for her, it's all about me. And I need to remember to be there for her. It's a lot to live up to. And sometimes we get really crazy over it. But we have to remember, everything we do is a world of difference to those people we are taking care of. All right? I can't say that enough. I'm a repeat on a lot of stuff. So the other thing is eye contact. More specifically, empathetic eye contact. Now, you don't want to be weird. I know my eyes do a lot of weird things sometimes, but you don't want to sit there and go, because let's face it, that's just kind of creepy. But you do want to use your eyes to show that you're paying attention, that you care what they're saying, what they're feeling. You want to be, you want to make eye contact, but you don't want to be weird on the eye contact. Now, also, a thing is somebody, especially who has cognitive decline, like a stroke, dementia, something like that, eye contact is very important there, because they may not understand any other way that you're actually paying attention to them. So that's an important thing to remember. Like I said, you want to be not creepy with your eye contact, but you do want to maintain it so that they do know you're listening. And that makes a big difference. Another thing is gentle touch. Now, you have to be careful because, obviously as caretakers, we're going to know how our people feel about this. But you don't want to touch them in any way that might make them feel uncomfortable. We're not talking about any weird touches. We're talking about like just a soft touch on the hand to let them know you're there. Touch on the shoulder, just something so that they realize you're there, but you're not being offensive or, no stranger danger thing going on. But a soft, gentle touch can be very reassuring. It can not only let them know that you're there, but it can let them know that you're there to help them. Okay? So that's something that you want to be able to keep up with, to remember. You've also got my favorite thing from COVID is bubbles. Okay? People have bubbles, and especially in caretaking, you got to remember you probably all live in the same household, so it creates a smaller area. You're having to make things specifically things where it's convenient for everybody involved. I like this one. Creating a consistent and predictable environment is key for caretakers. And it's also one that I'm probably going to do a future video on. But we want to be able to have a good environment. And sometimes for convenience purposes, especially if there's a lot of medical things that you have to do outside of just making them feel comfortable and all that, our areas can be very small that we work in. And bubbles are very important. I love COVID. 6 foot sounds great to me, especially if I don't know you. If I know you, you can come in a little closer. But we have to remember the people we're taking care of sometimes are going to have shorter, smaller bubbles than other days. And we need to keep that in mind when we're paying attention to their to their body language. Because their body language could be telling us, hey, their mind could be telling us, hey, come here, but their body language is like, okay, that's close enough. So you need to pay attention to all nonverbal communication. So not only their facial expressions, how are their body reacting? How is their breathing? Is it shallow? Is it nice, deep, and calming? What's their facial features? Are they like freaking out? Are they flushed? Are they really red? I got a guy at work, I can tell you his mood just by the color of his face. If it's red, he's mad. If the tip of his ears are red, he's annoyed. Normally, he's fine, but I can just walk up to him. I don't even have to talk to him, and I can tell you exactly what, what his mental condition is at that moment, emotional condition is at that moment. So we need to pay attention to this stuff and the folks that we are taking care of. These are our loved ones. Some people we have spent years with. Barbara and I have been together 20 years this year, and that's an important thing. I know a lot about her facial features and everything that she just doesn't realize that she has. So that's something to keep in mind and to pay attention to. You may not even realize it at this point that you know it or that they even do it, but since you watch this video, I guarantee you'll start paying more attention, and it will make a big difference in the communication style, because they won't even have to talk to you and tell you what's going on. You will know something's not right. Let's ask those inquisitive questions that can help pull out what we need to know to be able to help them better. And that's a very important thing. The tone of our voice and the volume of our voice. Sometimes we have to use the tone of our voice. We have to use our words and our talking and our tone and our volume to calm them down. They may not realize how upset they are, but we have to use our best effective communication skills to calm them back down and to relax them. And then to figure out, why were they upset? What's going on? Is it something I can help you with? Do we need to go to the doctor? And these are things that we need to be able to find out, and we have to get them calm enough to do that. So you want to keep your voice calm, and you want to keep it relaxed when possible. And you want to be able to communicate with them through your tone also. Now, this can be a little bit off if somebody is hard to hear, because you have to talk louder when you have somebody that's really hard to hear. So you want to keep that in mind. But especially if you have somebody with dementia, you want to stay calm. Keep a nice, calm, relaxing, soothing tone, so it helps them to stay calm. Because especially if you suffer from dementia, I've noticed that simple things can be very traumatizing, because they can't remember, and that upsets them and confuses them. So that's something to keep in mind. Another thing is, you do not have to constantly talk. There does not have to be constant communication. There's something that is just called silence, and it can be a very powerful thing. Sometimes you can be in the middle of a conversation and you need to just allow that silence, because they may need to process what was just said or what's going on. In our household, there'll be silence here all the time, because we'll be reading stuff. We'll be, Robin works from home. I have the YouTube channel that I'm working on, and Barb and Melissa are both disabled, so they a lot of times are listening to books, they're listening to podcasts, and they'll have earphones or earbuds in. We have a lot of silent time in this house, and you can be having a conversation, and just you need to stop and let the person you're taking care of just process information. I know with Barbara, because of her medicine or the condition, we're not really sure which, she has trouble processing information sometimes. It takes her a little longer. And so you need that silent time to help them to be able to do that processing. It's not a bad thing. It is something that they do need. Also, you need to, back to paying attention to the body language and nonverbal cues, will help you understand about if they're in discomfort or pain. Back to, how are they breathing? How do they look? Are they red? Could be blood pressure issues. Facial expressions can show if they're in pain. Are they moaning? That's always a good sign. Are they sighing? Are they sitting comfortably? There's all sorts of different ways that they can show discomfort, and that's just something as a caretaker you have to pay attention to and learn what their verbal triggers are. That's a good way. Sometimes you have to adapt communication needs for an individual. Now, I've mentioned before with Barbara, because of her condition, she can go long periods of time unable to talk and communicate. Her affliction specifically is attacking the face and the trigeminal nerves on both sides of her face. So there are times she'll have an attack and won't be able to talk. So we have, I'm not sure who got these, by the way, but they're great. They're little emoji squishies. So like this one says sleep, and then we have one that's got a heart, and all those little emojis, you can get these little squishies in, and that way she can just show them. Also, we have a whiteboard. I keep one on the refrigerator, so that way I can write down important dates and important information, and that helps her with the cues on what we have coming up, and it helps with the communication and with memory. It's a visual aid that really helps out, and I suggest everybody have a whiteboard, because also in the event they cannot talk, sometimes they can write. Now, this is not necessarily true with stroke patients, but with a lot of other conditions, if they can't write or if they can't talk, they usually are able to write. And a whiteboard is a great way of doing it, because you can write, and then wipe it off. Sometimes Barb's not able to text, so it helps out. Let's see. All right. Other than being consistent with your nonverbal cues, that about sums us up. Like I said, we have a specific way that we have over the 10 years or 12 years Barb's had this condition. We have put together a household that is very consistent for her. And it's we understand the verbal cues. We understand the nonverbal cues. We have the house set up in our area for her convenience. And this consistency helps with the caretaking, my caretaking and my caretaking duties. So I hope this video has helped. If you have any other ideas on good communication, nonverbal communication, please shoot it in the comments below. Don't forget to like, subscribe, and share. And I hope you have a great week. And you don't have to put all of these into practice. Just start with 1 or 2 and see how well that goes. Pay attention to what you're doing and see how many of them that you do that you don't realize you're doing. And you'll come to figure out that it's probably quite a few. I hope you have a great day, and I'll see you here next Sunday.